Hello doctors, this video is for qualified doctors who want to start a hair transplant practice or hospitals who want to add a hair transplant division into their existing setup. I'm Dr. Vivek from ISHR Hair Transplant Training. At ISHR we offer certificate and fellowship training programs to qualified doctors. The advantage with ISHR is we have a full-fledged running anagen hair transplant center with a lot of patients coming, going, so you can see the follow-ups, medical investigations and see the progress of various hair transplant. So it is not just a PowerPoint presentation and a few hands-on and you're going back. You get a real experience of a real running clinic with patients coming and going, surgery happening, follow-ups happening. So you want to replicate the same experience in your center when you go back after the training. We have a 1-year faculty support. When you start your own hair transplant procedures, you can access this faculty for 1 year so that you are under their supervision when you're starting your practice so that you cannot go any wrong. Dear doctors, in this competitive field of hair transplantation, you got to be the best, otherwise you won't survive. So you got to learn from the best of faculty and the best of clinic who are there in this field for more than 10 to 15 years. Our faculty includes team of paneled plastic surgeons, dermatologists, anesthetists, facial surgeons and a very well trained team of technicians. Because hair transplant, a doctor cannot do it alone. He needs a proper qualified trained team because it's a team effort. As I said, you got to be the best in this field so that you succeed in this field. Hence, you should be trained by those clinics who has very well experience of great results. So we are going to discuss with you what makes a great hair transplant protocol and what makes a poor hair transplant protocol. So don't do those mistakes which certain clinics may do, which may give poor results, but stick to the advanced protocol to get amazing hair transplant results. Few important points of global leadership in the hair transplantation I'm going to discuss now. Point number 1, which was introduced at our institute globally, is a super instant FUE. As you know, majority of the clinics, when they take the grafts out, they are out for 2, 3, 4, 5 hours. You know, if this finger is cut, you got to fix it immediately, otherwise it may die. So hair graft is like a fish. The moment it's out of its blood supply, circulation, oxygen, nutrition, it may die. When you put it back on the scalp, it survives 3 days with a serous fluid. Basic neovascularization anastomosis happens in 5-6 days. Better anastomosis happens in around 2 weeks. So first 7 days are critical for the graft survival because if the graft are kept out in chilled atmosphere, the temperature is different. The temperature in the scalp is 37 degrees centigrade. So we understand the molecular basis of a hair follicle. Hair follicle is an organ. So we thoroughly understand what changes in acidosis, sodium potassium channel, the oxygenation, the ATP, the osmolarity, the pH of a graft happens when it is out, and how do we make it survive. So this is very important thing newly introduced in ISHR last 2 years. So this is called super instant FUE, wherein we take out the grafts and implant it simultaneously. This has changed the results dramatically. So you are going to learn super instant FUE, point number 1. Point number 2, we are going to train you on both forceps technique for implantations, the implanted technique for implantation and a keep implanted technique for implantation, all the advanced techniques for implantation, not just one forceps hair implantation procedures. So this is also very important because when you do the eyebrows, when you do the beard, when you do the temples, you need keep implanters for a better angles and directions. Another unique thing with ISHR training is biotech FUE. When you punch the graft at the back, it will leave some micro scarring. People don't want it. Sometimes they shape the hair. So we have a unique protocol to reduce this scarring with some special products which we get it from all over the world and some special PRF techniques. So we reduce this post-FUE micro scarring. That's called biotech FUE, another new thing in the world of hair restoration. After that, the next technique we are talking about is once you have put the graft, what do we do? Because it's going to survive by its own. Sometimes it will not take up. So we have a special post-transplant care of special nutrition, ATP, amino acids, glucose, balancing the pH osmolarity, temperature control, so that for 5-6 days, the graft should be given the same atmosphere which it was getting before it was extracted from the donor. So there's a special post-transplant care for 1 week to enhance the survival of the grafts. After that, very important, the safety aspects in hair transplantation. It's very important. So our anesthetist is going to train you about ECGs, medical complications, emergencies, indications, contraindications, which patient you have to take, which you have not to take, When you have to do a 2D one, a TMT stress test. If somebody is allergic, you have to do an IgE. If you have a doubt, you do glycosylated hemoglobin. You check for top to bottom before taking any patient. So you should take a healthy patient, correct patient, because it's a cosmetic procedure. You don't want to do any harm to the patients. So understanding local anesthetic toxicity management is critical. What is intralipid? It's an antidote to local anesthesia. Understanding the basics of ECG. This is very, very important when you're doing a hair transplant, because it's a healthy patient coming to you, not the diseased patient. Then we're going to start with the theoretical part, the consultation in a hair transplant, the extraction process in the hair transplant, the implantation process in the hair transplant, the different techniques of implantation, the instrumentation for the whole hair transplant techniques, the role of magnification, checking every graft in a big projector so that every graft goes through a scan whether it is coming properly or not. Then whatever angles, directions, depth, curls we are putting, photographies are taken so that we know whatever we are doing, we can see in a big screen. Are we on the correct angle, direction, depth, curls? Most important, some doctors can give you more illusion of density with even less graft. So how to distribute the graft? Because normally the graft will be less and the bald area will be more. So hair transplant is also an art and intelligence. How with less number of grafts you can give more illusion of density. 5 degree at the temples one has to implant. At the frontotemporal angle around 10 to 15 degree. At the frontal scalp around 15 to 20 degree. The whirl pattern at the crown area. Different way to implant in the eyebrows, the beard. You can take out the body hair and put it in the scalp. You can implant on the scars also, on the burns also. We're also going to cover about scalp micropigmentation. If somebody doesn't have too much hair, we can create the illusion of hair through scalp micropigmentation for the hairline, for the temples, and for giving more density. So, a lot detailed theory will be covered in every aspect of hair restoration. Normally in this training, we start with theoretical training on phone, online, so that before you coming to us, you're well versed with the subject, okay? You will know everything about it. Then we ask you at home to wear a magnification, practice at home even before you're coming to us, because hair transplant is about under magnification, hand-eye coordination. If there's a thread and there's a needle, if I want to put thread inside the needle, it's difficult. When I wear a magnification, it's easy. So you have to practice at home. Hand-eye coordination under magnification will tell you how. So by the time you come to us, you know theory thoroughly, your hands are working well, your magnification is working well, so that you having more advantage when you actually do on the real patients for the hands-on training. Now let's come to the real thing. You've learned hair transplant, then what? You will definitely need some trained technicians to support you for the first year, because your speed may not be too much high. So we have technician pool worldwide. So we will provide you them, so that when you're doing a transplant, they're there to support you. This is very, very important. Otherwise, people may learn, they may not get so much confidence, so much speed, and they may not be able to do the transplant alone. Then we're giving you A to Z support. Apart from knowing the best, having a good team, having a good infrastructure, where to source everything from, you need to have a great digital presence, showing your before after pictures, showing your testimonials of the clients, letting the world know what technique you're doing, like we are doing, biotech, instant, direct, pen, FUE, and we keep improving every 3 years. We attend the best of conferences in the world, so you don't have to attend. So we give you the final outcome of so many books, so many articles, and so many conferences, so you don't have to go through them. Ultimately, it's your hand, it's your eye, and your passion for the work of hair transplantation, which will decide how successful you are in the field of hair transplantation. So we have A to Z support, right from digital presence, training, manpower, sourcing of equipments, updating you with the latest protocols. You can access our faculty for the full 1 year. So whenever you do new cases, you should be in touch with us. We should get the photographs, we should get the investigations. And whenever you're doing the surgery, making the hairline designs, you should be in touch with us initially, so that you're working under a supervision, you don't do any mistake. So hair transplant is about science, but it's also about art. If I have a long face, what sort of hairline should be? If I have a round face, square face, if I'm 50, 60, 40, 30, 25, I cannot have a skin age of 45 and have a hair transplant of 25. It will look bad. So female hair transplant is different. The role of soft hair in the front, the roundishness of the female, So a lot of issues are there. So we also have to look into the hair loss. So not every patient come to you need a hair transplant. You have to correct, does he have a PCOD, hypothyroid, low hemoglobin, high cortisol levels, high epinephrine levels due to the stress. So we will tell you some unique things. It's not just DHT alone which is responsible for the hair loss. There are a lot of other factors looking into hair loss. We also want to discuss about future of hair loss. So you have to understand the hair follicle, the human body, interaction within them at a molecular level, at a cellular level. What is causing this hair loss and what are the futuristic treatments that will come for the hair loss? Because you just cannot treat the hair, you have to treat the whole body. It's a reflection of the whole body. Like you got a stress, you got a telogen effluent, so which improves after 3-4 months. So we have to cover the hair loss, the non-surgical aspects. PRP is outdated now. If you do PRP, it's going to last 6 hours, 4-6 hours. But if you do a PRF, IPRF or EPRF, it's going to last 7-10 days, and EPRF may even last for 3 months. So we need to give nourishment through PRF, which lasts longer. So there are multiple other non-surgical methods. So there will be certain section of your patient who will look for a transplant, scalp magnification, and there will be other section of patient who will need medical line of treatment, PRF line of treatment, and some other non-surgical treatment. So this was brief about fellowship and certification hair transplant training by ISHR. If you have any questions, you can go down below, go to our website. There's a WhatsApp number given to you, the bottom number and the Kazala number. You can contact us. We'll tell you when is the next schedules for hair transplantation workshops across the world. And of course, the main center is in Mumbai if you want to have advanced training for a longer duration of time. So goodbye and see you. Wishing you a great hair transplant practice in the future.